we found that there is a lot of information out there, but often the information is overwhelming, it's generic, it's outdated. So my co-founder and I, we started Matida end of 2022. We recognized that there's a gap in the market in Southeast Asia when it comes to pregnancy knowledge, and this is what we wanted to solve with Matida. Matida is a parenting support app for families in Southeast Asia. So women can track their pregnancy and their newborn journey. They can get advice from doctors, they can ask questions, they can do knowledge quizzes, and engage in the community, get shopping recommendations, and simply support for this life-changing phase. The app focuses on holistic support. So that means we don't only have medical knowledge, but we also cover like financial knowledge, partnership advice, career and mental health support, apart from the purely medical topics. I would actually say engaging, because when we started using WebEngage and we engaged with the tool and like really started like thinking about the functionalities, then all the ideas came to our minds of campaigns that we could test and segments we could build and all these things. So it really sparked our creativity, and the whole team liked that a lot. Maintaining customer loyalty is super important. So it's good to start thinking about that and the communication with users early in the journey. The thing is that the WebEngage team, they are very knowledgeable. They ask the right questions and they structure the plans for your CRM communication. They have lots of ideas in terms of how to create good campaigns. So when you start as a small team, you don't have a lot of resources or maybe don't have the knowledge, that is very valuable because you can get a head start. Before WebEngage, we used to send messages from our backend, which was much less targeted. So once the integration of WebEngage was done, the tool was really easy to use and we could create campaigns quickly. So actually the whole marketing team was able to create them. So whenever we had an idea, we just went into the tool and created an email or push message and were able to send that quickly. So our support platform is on an app. So we always knew that our concept will only work if we actually deliver value and the users come back to the app. So we want to accompany families for a longer period of time. And if the app doesn't have anything they are interested in and anything that helps with their challenges, that they won't come back and we won't engage them further on. But we need that engagement and the trust so that we can actually suggest products afterwards, suggest services, which allows us then to monetize. So user engagement and retention is one of our most important metrics that we look at, because kind of everyone can acquire new users. We can just put more money into marketing, run ads, and then we'll have new users every day. But the value of our app only shows if we look at the cohorts and how many people actually come back and therefore like what we are doing. Personalization is one of the key functionalities of Matida. So it's our highest priority that we see the users and their individual challenges, because not every mom is the same. So that means the content that we deliver on our app is personalized to the user data that we collected. And that means we also need to do that in our CRM communication. So when we send out emails or push messages, they need to be really targeted to the women and all the information that we have of her. So we do that in the app, just helps us scale and be more individual. It's actually the simple campaigns that work best for us. So we created, for example, a churn prevention journey. We send out push messages to users that have not been active on the app for a certain period of time. And on the one hand, it was really interesting to see how many people actually enter this churn flow and becoming inactive. But also we were then able to create individual messages to win these users back. And overall, this specific campaign had an 11% conversion rate, therefore improved our cohorts, which is one of our most important metrics. And that worked really well for us.